ओम धम धन्वंतरे नमः। रागादिरोगान् सततान् शक्तान् अशेषकायान् प्रसतान् शेषान् औत्सुक्यमोहार्तितान् जघान योगोरवैद्याय नमोस्तु तस्मै। Today's topic is prevention of heart disease by Ayurveda medicine. Incidence of lifestyle disorders has been raised in the society in India and Indian subcontinent due to altered lifestyle, faulty food habits, and chronic psychological stress. The incidence of ischemic heart disease is constantly rising. Death due to acute myocardial infarction is now becoming common. Re- Reduced exercise, sedentary lifestyle, and use of high fat diet causes dyslipidemia and atherosclerosis in these patients. Atherosclerosis in the arteries of the brain causes hemiplegia, and atherosclerosis of the myocardial heart causes myocardial infarction and sudden death due to massive heart cardiac arrest in these people and arrest of these people. The common stages of ischemic heart disease are myocardial ischemia, myocardial infarction, acute myocardial infarction, and cardiac arrest. In Ayurveda medicine, the disease occurrence can be prevented in the society. Regular practice of exercises, pranayama and yoga, daily walking, use of Vyadhipatini formulations, regular exercise, a certain panchakarma therapy, patyapatya prayoga, and diet therapy are found beneficial in this disease. The heart diagrammatic representation. So here type of muscles. The third one is cardiac muscle. Okay. First one smooth muscle, spindle shape, central nucleus. Second is skeletal muscle with peripheral nuclei, multiple nuclei. And the third cardiac muscle, which is center. The nucleus is at the center. The cells are branched. The cytoplasm, the cell is branching and connected by intercalated discs, and it is striated also. It is involuntary and striated. This is in histology. You can see. So also you can see the fibers with central nucleus and branched cells. The cytoplasm branch. So in myocardial infarction, the ST elevation is same. ST elevation, and tall TVs in initial hours, then followed by ST depression and TO inertia. So it depends on the area of infarction. There is anterior wall infarction and inferior wall infarction, common, left ventricle. And in anterior wall infarction, the leads facing the anterior wall, that will be direct changes, and leads opposite to the anterior wall, they are showing reciprocal changes. Whereas in inferior wall infarction, leads facing the inferior wall shows the direct changes, and leads opposing the inferior wall shows reciprocal changes. This is how we see normal subendocardial ischemia, acute subendocardial ischemia, and transmural ischemia. In transmural ischemia, you can see ST elevation, tau T. So this is the usual pattern of myocardial ischemia, myocardial infarction. So you can see Q wave, that is size of infarction is denoted by Q wave, and ST elevation and upright tau T waves in the acute myocardial infarction. In this patient also, you can see the infarct changes. Lead 2 and 3 shows ST elevation. Okay. And yeah, V1, V1, V2, etc. They show ST depression. Coming to introduction. Ischemic heart disease has become the major cause of death in modern India. Obesity, diabetes mellitus, systemic hypertension, atherosclerosis, mental depression has become the precipitating disorders in this disease. In dyslipidemia, serum total cholesterol, LDL, VLDL, and triglycerides will be high. This precipitates into occurrence of atherosclerosis and thrombosis are of the major vessels leading to acute myocardial infarction or stroke. Ayurveda medicine has a positive role in the prevention of the heart disease. Single herbs used in the prevention of ischemic heart disease are gugulu, Comifera mucul, the resin is used, Rashana, Allium sativum, Arjuna, Terminalia arjuna, Nagabala, Maricha, Piper nigrum, Kanjanara, Mohinia variegata, Amlavetasa, Chitraka, Pippali, Piper longum, Pushkaramula, Inularissimus, and Haritaki, Terminalia cebula. This is the Terminalia arjuna, the Arjuna plant, isn't it? The bark is used. The Lashana, Helium sativum, the Gugulu, is the gum Gugulu, Commifer Umukul. It is purified, processed, and then used in the therapy. Coming to formulations used in ischemic heart disease, Arjuna Churna, Lashana capsules, Amrtadi Gugulu, Navaka Gugulu, Medohara Gugulu, Kanjanara Gugulu, Arjuna Rishta, Arjuna Shripathi, and Mrugashanga Vesma, Pushkara Gugulu, Swarnamalni Vasanta, Shilajatta Diloha, Shiva Gutika, Shilajata capsules, Rasna, Marasona Pinda, at Yogaraja Google. So also Papakaravati. Papakaravati is one of the main formulations of frequently used in cardiac disease. And if we see, to analyze the actions of the ingredients of the formulation used in ischemic heart disease, following actions are seen. Vatahara, Kapahara, Medohara, hypocholesteremic, anti-platelet aggregating, blood thinner, thrombolytic, anti-atherogenic, cardioprotective, Lekhana, Rukshana, acting on the blood vessels, Rakta Prasadana, Radhya, Rasayana, and hematinic. And also antistress, adaptogenic, anxiety, sedative, Nidrajarana, and CNS depressant. Now one by one we will see. Matahara, Yogara Yogulu, Pushadogulu, and Nagavala Churna. Kapahara, Medvaragulu, Murtadegulu, and Navakugulu. Medohara, Kajanaragulu, Vidangadiloha, and Lashana capsules. Hypocalcemic, Rajinu Shirapaka and Navakugulu. Antiplatelet aggregating, Marichi Churna and Gugul Churna. Blood thinner, Lashana capsule, Marichi Churna. Thrombolytic, Kajanaragulu, and Shilajatu capsules. Antithrogenic, Shilajitadiloha, and Navakugulu. Cardioprotective drugs, Arjuna Churna, Lashana, Shirapaka. Lekana drugs, Vachachurna and Medohara Gugulu. Ruksha, Yogshara and Yavamanda and dry fish. Acting on the blood vessels, drugs, Manjishtati Kashaya, Manjishta Churna and Sariva Churna. Rakta Prasadaka drugs, Brahad Manjishta Vikwata and Mahatitaka Kashaya. Vidya drugs, Arjuna Rishta, Ragasanga Bas, Prabhakravati. We have Rasayana drugs, Rasuna Pinda, Ashwagandha Churna, and Ashwagandha Leha. We have Hematinics, Navasaloha, Rakshadiloha, and Manavadimandra. In anemia of secretanemia, ischemia, myocardial occurs. Antistress drugs, Tagara tablets, Sarpagandha, Ganamati. Antistress is useful. Stress induces some changes, hormonal changes in the body, and that will aggravate the condition of ischemia, myocardial ischemia. We have adaptogenic drugs, Etavochurna, Sarsatarishta, and Shankapushpi syrup. We have anxiolytic drugs, Manasamitravataka, Brahmivati, and Medivati. Sedative drugs, Sarpagandha Ganamati, and Ashwagandha Churna. We have nitrogenal drugs, Ashwagandha Arista, and Sarsatarishta. We have CNS depressants, Etavochurna, Manasamitravataka, and Parasekevani Churna. Now let us see yoga in the prevention of ischemic heart disease. Anuloma Viloma Pranayama, the simple pranayama. Then yoga asanas, yogic diet, and Ashtanga yoga. Panchakarma therapy in ischemic heart disease, Mridu Virechana, Shirodhara, and Mridu Abhyanga. Patyas, Sushikashali, Yavarna, Madhudaka, daily walking, meditation, Lagasupa Chahara, and low fat diet. Apatyas, Snigdha Guru Ahara, Ati Vyayama, sedentary lifestyle, Bharavahana, weightlifting, indulging in Kama, Krodha, Lobha, Moha, Irsha, Dvesha, Matsarya, and Raga. They are the Mansika Bhavas. Coming to discussion. Ischemic heart disease is a psychosomatic disorder which is usually aggravating on exposure to psychological stress. It is usually seen in obese patients with dyslipidemia, diabetes mellitus, atherosclerosis, and systemic hypertension. It is usually seen middle and old age people. Atherosclerosis of coronary arteries and even spasm of the coronary arteries cause angina pectoris in these patients. In Ayurveda medicine, formulations which are antithrogenic and hypolipidemic usually prevent the occurrences of ischemic heart disease. Anti-stress, adaptogenic, anxiolytic, Medirasayanas, relatives, Nitra general drugs, and CNS depressants act on the mind and reduce the secretion of those hormones in like epinephrine and cortisol, reducing the episode of myocardial infarction. Yogasanas and pranayama and having anti-stress effect, and by increasing the vagal tone, the transcranial nerve vagal tone on the heart decreases the heart rate, heart activity. Hence, they help in relieving stress on the heart musculature. Hence, Ayurveda medicines have a positive role in prevention of ischemic heart disease. Low fat diet, free fat-free diet helps in controlling dyslipidemia and reduce the chances of heart attack. So coming to conclusion, Ayurveda medicine has positive role in the prevention of ischemic heart disease. Development of complications of ischemic heart disease can be prevented by using Ayurveda medicine. Medohara Travias, low-fat diet, hypocalcemic drugs, and CNS depressants help in the prevention of ischemic heart disease. Along with conventional modern management and add-on therapy, Ayurveda medicine proved having positive role in these patients. So these are the reference. Today we have discussed the prevention and treatment of the undiagnosed of ischemic heart disease. Thank you.